My name is Nicolas Tavagnutti. I'm a procurement and supply chain management expert, and I have something like 25, 30 years experience in this area of expertise. So I was working in Asia, in Africa, in Europe, in Southeast Asia, so everywhere. So I have quite a wide experience in many countries. So today we are a few people, so it will be like a friendly discussion. We're gonna speak about emergency pandemic and humanitarian public health, procurement and supply chain management. So kindly mute your microphone and turn off the video. Please ask question using the chat box and raising your hand. You may ask question in the chat box at any time. When and only when you are invited to speak, please remember to unmute and turn on your video. Webinar recording will be available in Empower School channels. The slide deck will be shared with all participants. So the main objective of the webinar is to give you a chance to ask any question to be answered by an expert. Today, the expert is me. In this course of this, the speaker will summarize the model, then invite questions. So we will have two parts. The first part, we will present emergency definitions. And in the second part, we will present logistic and inventory management. So let's start with the introduction. In this session, we will seek to understand the basic definition of emergency related to conflict, disaster, and pandemic situation, and why the PSM people should be much more prepared for further events. We will discuss on international organization, donors, and their direct effect on the PSM activities. Eventually, it will outline the need for effective PSM advocacy to be much better prepared for further events. When you receive the slide, links will be available. Do not just look at the link, just try to search by yourself, question yourself, find your own approach and your own understanding. It's a short presentation and we cannot cover everything. So as mentioned earlier, we will have two parts. Overview of emergency situation, conflict zone, natural disaster, man-made disaster, pandemic, and second part, COVID-19 consequences on PSM, efficiency and resilience balance, lack of recognition of PSM, and PSM advocacy. So as you can see, we have several emergency, conflict, disaster, man-made crisis, and pandemic. All of them can create an emergency needs because they often arise suddenly and unexpectedly, requiring immediate action to address them. In emergency situation, people may require essential resources such as food, water, shelter, medical care, or safety. In some cases, emergency can also create new needs that did not exist before. For example, the COVID-19 pandemic has created a need for widespread vaccination effort, remote work technology, and mental health support services, among other needs. These needs arose in response to the pandemic and have become essential for addressing the ongoing challenges it presents. So we have a term of conflict. The conflict arises when two or more groups believe their interests are incompatible. Conflict is not in itself a negative phenomenon. Non-violent conflict can be an essential component of social change and development, and it is a necessary component of human interaction. Non-violent resolution of conflict is possible when individuals and groups have trust in their governing structure, society, and institution to manage incompatible interests. Conflict becomes problematic when social mechanisms and institutions for managing and resolving conflict break down, giving way to violence. Society with weak institutions fragile political system, and divisive social relation can be drawn into cycle of conflict and violence. It could be interesting to read a book from Mr. Peter Wallenstein, 2002, who recognized three general forms of conflict. So interstate, which is a dispute between nation states or violation of state system, internal, and state formation conflict. So you see on the graph at the right side on the map, you have the world at war in 2022. You will be able to download this map with the link down below. Even if your country is not located in a conflict zone, it may impact your supply chain, especially in Asia, where most of the health products are coming from. That's why you need to be aware where located the conflict zone and the impact it may have on your supply chain. Let's take an example. For example, the war between Russia and Ukraine. Ukraine war made a massive impact on the pharmaceutical sector. For example, Russia closed around 30 countries for airspace. Means goods flown by air freight from Western China to Europe must reroute on or relay on another slower or more costly mode of transportation. Ports have seen tons of congestion. So this is not going to help. And we already have a lot of medical supply trapped into containers. In anticipation of delay, you see the factory all over the world that either stop producing or are delayed their production. Shipping operation times from China to Europe and China to US grew steadily from 40 to 50 days in 2019 to around 110 days in 2021. So it's double. Can you imagine that? At the same time, India's pharma sector is the most vulnerable. Why? Because Indian pharmaceutical industry experienced a ripple effect of the ongoing Russia-Ukraine crisis, as majority of domestic players have a strong presence in both of the countries. Pharmaceutical products constitute one of the main exports from India to Ukraine. India is in fact the third largest exporter of pharmaceutical to Ukraine. Moreover, sanctions imposed by US have also affected trade payment from Russia. Transport price increase to sanction on oil, etc., etc., etc. So I will explain more in detail later on why China and India are so important in the health product. Now we jump to disasters. There is no general definition for disaster. However, most of the organizations have a similar definition, such as the United Nations, WHO, or IFRC. IFRC means International Federation of Red Cross and Red Crescent Societies, to declare natural disaster. But you need to make a difference between emergency and disaster. An emergency is handled internally by a government. Declare disaster when there is a need for external assistance. National government declares a state of disaster to request international humanitarian assistance. So, when you have a disaster management with some phases. You will see down below disaster management and a cluster proposed by UN. So in these phases, you have the response phase, where activities such as search and rescue, rapid damage and need assessment, and the provision of first aid are conducted. The second phase is the rehabilitation, where basic services and the lifelines are restored, even on temporary basis, including the road networks and other facilities like a bridge, airport, port, helicopter landing site, etc. And the third phase is recovery phase, where reconstruction efforts are carried out on the basis of more precise assessment of damages and destruction of infrastructure. All response activities are done by the United Nations and coordinated by OCHA. It's Office of the Coordination of Humanitarian Affairs. they define 11 clusters. Each of the clusters is headed by one or two organizations or agencies. So I recommend to you to click on the UN cluster, UN link, and you will see what I'm talking about clusters and organizations. So we talk about disaster. Now we have natural disaster. This is a very interesting graph. In natural disaster, such as hurricane, earthquake, or flood, people may require emergency assistance to meet their basic needs. What is impressive nowadays is we know almost minute by minute what's happening in the world. We are constantly reminded of the last disaster. If we look historically the death, you understand that the huge impact of the disaster and the death. But however, over the year, the death decrease. Why? This trend does not mean that disasters have become less frequent or less intense, because we are much better prepared. We have now the man-made disaster. Man-made disasters are events which are caused by men, either intentionally or by accident, which that can directly or indirectly cause severe threat, either directly or indirectly, to public health and or well-being. So we have different kind of man-made disaster. As you see on the graph, you have natural disaster 52%, man-made disaster only 6%. But you have both natural and man-made disaster represent 42%. What are both natural and man-made disaster? For example, if you remember Fukushima in 2011, that was due to a tsunami. However, Fukushima was a man-made. It was a plant, nuclear plant, explode, or one of the reactor explode. So you have both natural and man-made disaster. Because the occurrence is unpredictable, man-made disaster pose an especially challenging threat that must be dealt without vigilance and proper preparedness and response. Now we jump to another kind of emergency, which is the pandemic. Again, there is no clear definition on pandemic. In the past, pandemic can be said to occur annually in each of the temperate southern and northern hemisphere, given the seasonal epidemic across international boundaries and affect a large number of people. However, seasonal epidemics are not considered as pandemics. So now WHO review the definition of pandemic, and they consider the term of pandemic for very serious and deadly diseases. So what you have to remember, it's three words: outbreak, which mean local; epidemic, which mean national; and pandemic, which mean multiple country. Okay. So this is as well a very interesting picture, where over the year we are getting better with pandemic. We are not so good. Have a look about the COVID-19. But you see the COVID-19, where is the COVID-19? It's, if you go down, it's number, yeah, sorry. Do you see the graph? Hello?
Yes.
Okay.
Yes, we can see the
Yes,
graph.
you can see.
Sorry. So, yeah. You see the COVID-19, if you go down below, it's, I think, number 5. So it's not the big pandemic we were talking or referring to. Just I recommend to you to click on this link to just understand what is the deadliest pandemic in history. So what are the consequences? We need to understand the economic and human impact of all this disaster. Remember, it's not only what is happening in your country, but all over the world, as it may affect the supply chain all over the world. And so it may affect your country as well. For example, let's take an example of API. I think all of you know what is API. It's an active pharmaceutical ingredient. It's the active component in the pharmaceutical drug that produce the required effect on the body to treat a condition. API in a pill represent probably 75% of the total drug, you know? In a modern pharmaceutical manufacturing, the manufacturer don't make API, they buy it. They don't make gelatin, they buy it. They don't produce vial, they buy it. The model pharmaceutical manufacturing just assemble the product. Where do you get all these products? From China. Before, nobody knows about Wuhan. Who knows Wuhan? Now we know. In fact, it's the center of API manufacturing in China, Wuhan. 80% of API come from China and India. India sourcing about 70% of API from China. India export about 20% of the world's generic medication by volume. When they went to lockdown, there was no API available. And India was buying the API from Wuhan. When they locked down, it was a nightmare. We're gonna say the same for gloves. 90% of the latex for gloves is producing in Malaysia. When they lock down, it's over. We have no more gloves. So what is new? Nothing is new because none of these situations are new, you know? They have been with us for centuries. But it's very important for the public health, procurement, and supply chain management to be prepared for such event and ready to respond. No need to be a fortune teller to tell you that it will happen again. Are we ready? For example, are we ready for the climate change, for example? Not sure. So here you have two interesting links and probably manuals you can download and read if you have time. So now we jump to something we call FCAS, which is fragile, conflict affected, and emergency situation. OECD, which is the Organization for Economic Cooperation and Development, it is an international organization that works to build better policies for better lives. They define fragility like state with weak capacity to carry out the basic state function of governing a population and its territory. This is a definition of fragility. However, there is no general definition for FCAS, but we use to refer to the ADB1, which is country in these situations may experience political instability, weak governance, economic and social insecurity, poverty, civil unrest, and have recently experienced conflict or disaster. These conditions create challenging operating environment, which often limit the capacity of local industry and the ability for borrowers to plan for and implement procurement activities. 25% of the world population is living in FCAS, which is around 2 billion. Bear in mind that there is a transition between non-fragile and fragile, and fragile and non-fragile. You don't become fragile or you are not a non-fragile like that. There is all the time a transition. You see, this is a list of facts. 25% of the population lives in FCAS. It may rise to 46% by 2030. Nearly half of the population all over the world. Conflicts drive 80% of the humanitarian needs, etc., etc., etc. You have all the facts. You can read them, and of course, you can check the statistic from UNHCR, where you have a very complete, let's say, a file regarding all these numbers. It's quite impressive. So, as a PSM person, you need to know the facts. Once you know the facts, I will tell you what to do with the facts. So who defined FCAS? On the right side, you have, I don't know if you see that, but anyway, you have the link. You have the list of fragile and conflict affected situations. So you have the list of several countries. It is undertaken by recognized international organizations such as the World Bank. World Bank is the one who is listing this kind of countries. It is important for the PSM expert, as I mentioned earlier, to know what countries are FCAS, as it helps to trigger funding. We need funding to buy commodities. Remember Ukraine, COVID-19, and then impact all over the world. That's why you need to know. So why it's so important? Well, because it triggers funding, we just said, but because different donor, different rules, different emergency, different rules. For example, in case of natural disaster, the speed, timeless, and delivery of critical goods are very important. Speed, simplicity, flexibility. So again, you have two links and you will see WHO and ADB, what are their response in a case of emergency. And finally, the word I didn't use from the very beginning, it's humanitarian. Depending the organization, agency, you will hear many words related to business, value of money, and you will have to work with that and understand that many focus on business and procedures only, but never lose sight. The reason we all do this, it is the reason to serve the people in need. Focus on people when working on humanitarian. All the time, focus on people. It's your motivation. It's your fuel to overcome obstacle. Okay, now QA session. So if you have any question or if you want to share your experience, because I know that many of you were working in COVID-19 in Africa or somewhere else, you're welcome. But if you have any question, please let me know. And if I'm able to answer, I will answer, no problem. Any experience to share with me or with us about your emergency experience in Africa, in Asia, or in another country? Golden silence. Any comment, any adding?
If you have any questions, please feel free to unmute yourself, or you can simply drop your questions in the chat box. We are waiting for your questions. Okay, we have one. Okay. I guess we can proceed further.
Okay, no problem. We can jump to part two if there is no comment. If nobody wants to share their experience on COVID-19, or if they maybe maybe the second part will raise some issue.
Okay. Or I suggest that if you can just ask questions from them. If
Okay, let me check if. Oh, that's not this one. Can you see my screen? Is it the right one?
so is this is your WhatsApp.
And this is a WhatsApp.
Page,
Okay,
yeah.
so let me check.
Yes, this is the PPT now.
Okay. So now we jump to the second part. So let me check. Logistic and inventory management. So this is an important chapter. And again, we have not a lot of time, so it's only just summary. Why logistic and inventory management are so different during a pandemic? Oh, that's very simple. In normal situation, you have buffer stock, for example, able to cover some emergency. But for a pandemic, PSM experts face issues because of sheer of volume. For example, during COVID-19, PPE volume increased by 1,000 times. Can you imagine 1,000 times? Here you have two pictures. These two pictures were taken in Lao PDR, which is a country in Asia, population 6 million. On the left side, you have around 60, let's say, monitors, patient monitors for hospital. Not a lot, but you see the space all these monitors take. And on the right side, you have suction pump, around 60 suction pump. And that takes another room, which is quite big for only 60 suction pump. In fact, if you multiply by 10 or 20 to cover, for example, all the need of Lao PDR, you need 20 rooms like that, which is huge and complicated to manage. In Lao PDR, for example, the warehouse was full, the warehouse of the Ministry of Health was full of PPE. It was impossible to put PPE inside the warehouse. So they have decided to set up tents outside the warehouse and to put in these tents all the PPE. They couldn't send to the provinces because the storage in the provinces were full. In the district, impossible. Everything was full as well. So as the procurement and supply chain manager, you will have to deal with a sheer of volume during a pandemic. So in reality, you cannot be prepared for such volume increase, but we can have some times to activate emergency mechanism. That means we need to have some strategic stock in place. I will give you some example later on. We may have product we'll never use, but at least we have this product in case. We may have contract with supplier for emergency purpose only, but at least we have these contracts. You see, MSF and UNICEF, they have this kind of contract. They have this kind of store. Strategy to make supply chain more resilient to demand spike and the disruption include postponement, strategic stock, flexible supply base, flexible transportation, flexible supply contract, flexible manufacturing process, etc., etc., etc. Let's take the UNICEF case. This is a very, very good case. UNICEF average annual procurement for all different types of face masks sourced via UNICEF did not exceed 25,000 units quarterly. However, when the impact of the COVID and the demand for some PPE product specifically used in response to the COVID have risen as high as 1,000, 2,000-fold. UNICEF at that time Demand estimate for gowns and coveralls for 3 months periods is approximately 25 million units. And the demands for masks, both surgical and N95 masks, in response to the COVID-19 exceed 55 million. How they do that? As mentioned above, they have contract in place with 1,000 suppliers in case of emergency, not for COVID, but in case of any disease. The COVID-19 has had a major impact on global logistics, in part due to the reduced air freight capacity, but also reduced workforces at airports, ports, and warehouses. Logistics services have also been impacted by decision of local authorities to shut down logistic infrastructure, enforce movement restriction, or put in place additional requirements in order to suppress virus transmission. This has considerably hindered supply operation. But you see, UNICEF was prepared, and I'm pretty sure that MSF was as well. So normal situation. In normal situation, the PSM manager will manage everything. PSM staff is considered as a wizard. You ask them, and they deliver. They are wizards. The global supply chain that modern companies depend on were turned upside down 3 years ago after COVID-19 emerged in China. The spread of the new respiratory illness and effort to slow it resulted in shortage of everything from toilet paper and prescription drugs to refrigerator and semiconductors. Even if we have manufacturer and product, we didn't have transport because of restriction. We didn't have container. They were located in the wrong place. So the question, does the COVID bring everything to the supply chain? No. In fact, no. It was already here. COVID-19 had just highlighted the problems. Before COVID-19 hits us, our supply chain were already in very poor state. When we look at the report from the United Nations, the Global Fund, that we are failing to get supply to the patient, even when we have the money, even when we have the stock. We are not getting the supply to where they need it. It's not happening. We already failed to meet the Millennium Development Goal. I don't know if you remember what is a MDG, the United Nations Millennium Declaration signed in September 2000, commit world leaders to combat poverty, hunger, disease, illiteracy, environmental degradation, and discrimination against women. The MDG are derived from this declaration. Each MDG has targets set to 2000 or 2015, but we fail. And now we are failing to meet the Sustainable Development Goals. The Sustainable Development Goals, SDG, were adopted by the United Nations in 2015 as a universal call to action to end poverty, protect the planet, and ensure by 2030, all people enjoy peace and prosperity. 2030. There are 17 SDG, but we fail. One of the reasons for that is our supply chain are performing so poorly that if we had better supply chain, we could save at least 6 million lives. It's a massive condemnation for just how weak and fragile our supply chain are. And that was before the COVID hits us, before Ukraine and Russian war. So what does it mean? That means we need major shifts, bringing supply chain home, more local sourcing, investing in more technology. For example, prior to the pandemic, over 50% of the company didn't communicate with or know the location of their supplier, making it difficult to anticipate shortage. So you see on this drawing, you have just in case compared to just in time. The company used just in time inventory to reduce excess supply and create a lean production process, while just in case inventory is used to avoid running out of stock due to a sudden increase in the demand. You see, on the left side, you have efficiency. On the right side, you have resilience. Efficiency, it's opposed to resilience. When you reduce one, you increase the other. Less efficient, more resilient. Before, all the objectives were to reduce cost, and we succeed. Low price, low operating cost, more volume, but same amount of human resources, same warehouse, same old truck, full training. When the problem hits the PSM, we were not able to handle it because we didn't have enough resilience. So what we need to try to find, it's a balance between efficiency and resilience. The classic approach is fast, good, and cheap. The balanced approach is agile, assure the right quality, cost effective. What does it mean, agile? That's being able to respond in appropriate and timely manner to changing circumstances. Cost efficient, effective, not the lowest price, but having the total cost of ownership, having a secure and reliable supplier over the long term. Assure quality means not the high cost brand, but the verified quality to international standard. So the solution is risk management approach. I recommend you to download this one from USAID, which is excellent. Risk definition. This is a probable events which may occur suddenly, and this event brings substantial negative consequence to the PSM system, thus to all the programs, because if the PSM system fail or the program fail. Management risks, that's to ensure that improvement are sustainable and high performance of the procurement and supply function is maintained. Risk need to be adequately assessed and then mitigated. So the reality is quite different, you know. The time to build is now, after the COVID. Are we doing that? Not really. The reality is we are doing little to improve the supply chain resilience. Why the COVID-19 didn't create a shock? Why? Well, because we have a lack of balance between efficiency and resilience. Generally speaking, as we become more efficient, we become less resilient to unexpected events. We saw that just before. We just have enough stock. We just have to order a little bit. We order in time. It's cost efficient, but it's not resilient. If we increase buffer stock, we become less efficient, but more resilient. Our procurement is too rigid. We need to become more flexible because we become too reliant to one supplier or on a few sources, and we have inflexible, bureaucratic, slow to respond. We have lack of professional. Why we have lack of professional? Because we don't have enough training. We should put that on a budget. You know, you need to include, let's say, formation or training for the PSM staff. It's costly, but it's useful. We need that. So, worldwide preparedness plan. This plan was before the COVID-19. You see all the country, number one, USA, England, etc. They were supposed to be prepared on the pandemic, on the COVID-19. Unfortunately, only 4 countries implemented it and have the PPE, glove, etc. Why? Because we have nice, let's say, papers, preparedness plan, but we never try them. We never test them. We are failing to plan. So I recommend you again to read this interesting paper about ranking global pandemic preparedness plan, and you will see why all the countries fail during the COVID-19. So how can we change the PSM approach? Well, a PSM specialist, as a PSM specialist, we need to educate people. We need to share the facts with them. The facts I was referring to on the first part. The message to bring is to use a different type of PSM for humanitarian and pandemic response. For that, we need to advocate. What does he mean? It means we need to influence decision with political, economic, and social institutions. Not easy, but we must do it. You need to do it. If you are a PSM expert, you need to do it. Influence, advocate, bring facts on the table, change. And for that, of course, you use two very interesting tools, coordination and cooperation. And the glue of the coordination and the cooperation, it's the trust. The trust contributes significantly to increase the efficiency of the coordination and cooperation. So advocate, use the coordination, use the cooperation, use the facts, because the facts will help you for the other people to trust you and maybe to change the PSM. We have to bring back the PSM to balance, to be prepared for the future. Next pandemic is coming. It's just a question of time. Maybe it's not a pandemic. Maybe it's a climate change. So we have to be ready. Advocacy will help to make this critical change. Thank you. And if you have questions, please go ahead. Or if you want to share any of your experience.
The chat box is loaded.
Okay, I can take the first question. Are there regulations on price health supplies during pandemic, price during COVID pandemic, where went so high that the public complained of the health institution taking advantage of the situation to make money? Yeah. You know, it's business is business. It's very difficult to say that the price are regulated during a pandemic. As I have mentioned, you know, if you receive 80, let's say that if a factory in India receive 80% of the API from China, and suddenly they receive only 20%, you have to understand that they need to launch the production of some product, and it's costly. So maybe they use the pandemic to have a higher price, but the problem is there was no transport. There was no API available. So, you know, it was a very complex situation. And I'm not sure all the company took an advantage of the pandemic. They were dealing as they could. So it's complicated to say, yes, they were taking advantage of the situation to make money. I'm not sure about that. You may have a lot of reports regarding this situation at that time. So probably you may refer to these reports from maybe WHO or the United Nations or some other organization. I need to get clear management of contract is supply for emergency situation without pandemic. Not sure to understand this question. Is it a question or it's what you need? Okay, I will answer maybe to that one later on. Yeah.
Sorry, Nicolas.
Yeah.
Maybe just a follow up on Dr. Immaculate's question. I understand the laws of demand and supply. It's is that when demand is high and supply is low, prices are generally going to go on the high side. But is there a way that we can regulate, or we can advocate for regulation of these prices, so that the hike is not as astronomical? I'll state, for example, we had masks which were being sold for more than 300% the normal price. So I think we have to think around this so that we can solve this solution, to come up with solutions.
Yeah, I would like to be positive on that, but I'm afraid I won't be positive on that price fluctuation, because you know in this kind of crisis you couldn't find masks. So if you want masks, you pay the price. You have probably one boat going from that place to another place. You have to pay for that. So the cost is very high. It's very complicated. So that's why I said you need to change your PSM approach. That means you need to have your mask already in place. Maybe you will never use. Maybe you will lose money on that, but at least you will have PPE and mask in your warehouse. So it will change everything. That means in case of pandemic, at least you can use this mask and have a look about the next order to buy more PPE, or to wait for price regulation. But price regulation during pandemic, I don't believe it. I don't believe it. It's possible, but I don't know how the authorities and the governments and everyone will do that. If I take, for example, an example, in France, we have problem with paracetamol. We don't have paracetamol. We produce paracetamol in France, but we don't have. Why? Because the one producing paracetamol, they say, okay, French government, you want to buy the paracetamol this price. Listen, outside, they double the price. I will not sell to you. I will sell outside. So we don't have paracetamol. And the same for India. France government say to Indian companies, okay, we want to buy paracetamol from your factories. And they say, okay, how much? This price. No, sorry, you are not the priority. Other people, they buy double price. This is business. And we are talking nowadays after the COVID-19,
That's true. That's true. So it also depends with the magnitude of the disaster or the pandemic, because if we are to opt for stocking, it has costs that are associated with it. So I don't know if you are getting me there.
Yeah, I understand your point, but it's complicated. It's really complicated. So I don't know if I answered to your question. Even during pandemic, people will fight to have the product, and they will be ready to put the price on the table, then to buy that with whatever is the price. We are not talking about only pharmaceutical. We are talking about, again, toilet paper. It was easy, but in Europe it was catastrophic. There was no more toilet paper. So the people were ready to put $1,000 for one toilet paper. It's crazy. It's human being, So maybe I will jump to another question. During COVID-19 response, it happened to be one of the rapid response team. The major challenge I observed was a lack of coordination and leadership at the district level. Further, it was hard to manage the response without compromising other health services. Yeah, that's a problem. That's a problem, and it was not only in one country, it was all over the world like that, So this lack of coordination and leadership was already in place, and the COVID-19 highlighted the problems. They didn't create it. It was there already. So that's why you need already, when, let's say, everything is fine and is calm, to strengthen the coordination, cooperation, and leadership. This is very crucial. If you don't do that for the next pandemic, it will be the same. And the next pandemic will come. I don't know when. It's question of time. And if it's not pandemic, it's another war. And if it's not another war, it will be climate change. So we have to act right now. That's why we try to empower, to raise and to train the people to change their approach of PSM approach. A lot of managers and leaders in many organizations, they think that the PSM is one people in that room and you ask them and they deliver. It's much more complicated than that. So the PSM people need to advocate, need to find out where are the issues, need to coordinate, collaborate, find leadership at the national level, at the provincial level, at the district level. You need to assess. That's mean right now. You need to go to the district and try to find why it was not working during the COVID, because it was not working before. So you need to assess now. Hello, will slide be available? Sure. True preparation is the key. For with pandemic, there will be increase in prices, challenges in logistic country that we get for pharmaceutical from without a challenge. May I cannot see that. Not export of supply making access challenge. Maybe fatal. Okay, that's a comment, yeah. If I got you correctly, you mentioned that if efficiency increase, resilience decrease. What is the best way to find a balance between the two? That's a good question. You need to find the right balance. That's a problem. You know the problem, if you have less efficient, the donors or your boss will say, oh, we are losing money. Why do you buy such amount of product we will never use? Come with facts. COVID-19. Come with facts. COVID-19. War, Ukraine, Russia. What do you need more? You understand that before we were not resilient, we were efficient. Let's be a little bit less efficient and more resilient. For example, in many organizations, when you launch a tender to buy pharmaceutical product, you award the contract to the cheapest one. Okay, let's do different. Let's award contract to 3 suppliers. Let's say 60, 1, 20, and 20. Of course, instead of costing you $100, it will cost you $130. You become less efficient, more resilient. Buffer stock, you have no buffer stock or your buffer stock is 10%, increase by 30%, less efficient, more resilient. Put some kind of emergency stock in your store. You will never use probably, less efficient, more resilient. It's what we have to do. Have contract in case of emergency with some supplier. In case of emergency, you need to have that data in place. Maybe you will have to pay this kind of contract every year. Maybe you will never use, maybe you will. Less efficient, more resilient. So you have to find the balance. And you cannot find alone. You need to discuss with everyone. You need to coordinate, cooperate. You can do that with several organizations all together. You can discuss and see what is the best approach. But always use facts. The facts I have described it, or the facts you may find in searching on internet. I have a question. From the effects of war in Ukraine, what's the best route you can take for an improved procurement from country near the war zone? Oh, that's a complicated question, you know, because that depends on the NATO resolution, on Russia resolution, on Ukraine resolution. I don't know the best route. And sometimes the route to find the best route to go near these country zones, it's just to refer to the United Nations, how they are managing things over there. So I am unable to answer to your question, but you may find probably the best answer in NATO or European Community or United Nations website regarding to this very specific conflict zone. In emergency situation like the COVID-19 pandemic, we saw need of PPE and other equipment. We didn't know that we could need them. Yeah. Question: how do we foresee the pandemic as a logistician and get prepared in terms of what we need and all the contract, as you said? Well, as a logistician, you cannot work or you shouldn't work alone. That's mean when preparing a pandemic plan or any problem like the COVID-19, you need to discuss with the MOH, for example, or with a specialist in pharmaceutical or this kind of area or perspective. You need to discuss with health professionals. They will tell you what they may need in the future, what you may need in your store, ready to be shared, what you may need at the national level, at the provincial level, and at district level. Don't forget, not only on national level. So you cannot decide by yourself. You will decide according to the discussion you may have with these expert people, with these specialized people. And of course, you will need to speak with financial people because that requires money, requires funds. So you will need to include in your discussion financial people. So health people, financial people, and logisticians. So even in crisis, the money is more important than serving humanity. So what is prepared plan for PSM in the future emergency? So even if the money is more important. Yeah, I wouldn't say that money it's more important than saving humanity. Right now, if you don't have money, you can do nothing. You know, if you want to distribute a PPE in your country, if you don't have money, you won't be able to do it. Unless you have donors, a lot of donors, but donors can only probably give to you, but not to the others. So yeah, money is important. Unfortunately, it's something we can escape with. But the money comes from the donors. In case of any problem, you need to meet the donors. And donors are not only ADB or the World Bank or the United Nations. As far as I remember, in Southeast Asia, the donors were the government of Japan, was the government of Korea, South Korea, was, you know, you have a multiple type of donors. So in case of any issue, if you need to find money, and the money will help you to save people, go to knock on the door of the embassy in your country and say, okay, we would like to have a preparedness plan for further the pandemic in our country. So are you able to help us? We have a plan, we have a quantity, we have a price. Are you ready for that? So knock on their door. They may have money to support you. I am from Angola, and during war conflict, we had many people dying with lack of medicines. Now we are in peace. We are still facing delays in pharmaceutical product, and people are still dying. Apart from war, disaster, pandemic, what do you think are the major problems for medicine delay? That's a question I would be able to answer if you invite me to Angola, because factors are many. Why you are facing delay? Is it because you don't have a procurement plan? Is it because you didn't plan correctly? Is it because the route is very long? Is it because? You may have a lot of causes for that. So that's why you need to use the risk management approach. You need to find out, because PSM starts with product specification, quantification, procurement, delivery, distribution, etc. This is the PSM cycle. So you need to go to the product selection. Do we have a problem in the product selection? Maybe yes. Maybe to select a product, it takes 6 months when it should take 1 week. So maybe the delay is there. Maybe not. Maybe the delay is quantification. You quantify for 1,000 pills when you did 10,000. Well, probably you distribute 1,000 pills, but you need to reorder. So, you know, you need to go back to all the PSM cycle and check every activity, what's going on. You need to assess each of the activity, and you may find where is the delay. You can find out, oh, the delay is here, and according to that, you can take an action. You can readjust this activity and try to find out why this delay is caused by. Is it caused by people? Is it caused by a lack of interest? So it's not easy to answer to your question. But again, have a look on the cycle and assess each activity of the cycle. And I'm pretty sure you will find where come from your delay, and you can probably manage the delay and to find a solution. Yes, Sarah. There are several factors. Okay, so if you want to discuss about this delay, no problem. We can talk. No. One major challenge in many resource-limited countries is fragmentation of PSM and lack of proper coordination. In such countries, it's difficult to get reliable data to plan for emergency situation. Well, Stefan, I think it's in a measure of the country. Most of the country, they are like that. It's lack of proper coordination, difficulty to get reliable data. It's unfortunately, it's all the same problem everywhere. Again, PSM, procurement and supply chain management, it's a cycle. You have activities. You need to check all the activities and assess all the activities, and you will find the problem. I'm pretty sure you will find the problem. Coordination, cooperation, you need to build that among other partners. You need to build that with a district, with a province. You cannot stay in your national place or capital and just order. You need to move to meet the people. So it's very complicated. And the problem is if we don't solve all this issue right now, unfortunately, I'm afraid that we will again face issues for the next pandemic or next crisis. Our situation in Southern Africa in terms of supply for pharmaceutical is due to unforeseen circumstances. How does advocacy play a role in improving supply? You don't improve supply in advocacy. As I had mentioned, many people don't understand PSM. They don't understand. So you need to advocate and to explain what is PSM, what is the role of PSM staff, how it works, what are all the activities. When managers, M&E people, finance people, they understand better what is the PSM, you bring facts. That's been what's happened during COVID-19. Why the world exploded during COVID-19, why the world was not prepared because of the COVID-19. Facts, resilience, efficiency, facts. That's been PSM was not ready. PSM, again, before and now is exactly the same. We have the same amount of people working in the PSM. We have the same warehouse, as I said, the same truck and everything. Nothing changed, but we reduced the cost and the volume increased, but with the same amount of staff. Maybe not all professional. So advocate, coordinate and cooperate, and ask to your managers, to the donors, money for training, money to improve the human resources in the field. And when you succeed to do that, well, you improve the supply chain management, for sure. It's costly. It costs money. To train people, it costs money. To train people, maybe it costs $1,000. It's for a year, for 6 months. You may send them abroad. You may recruit more people, but that you need to put that in your budget. If you have the possibility to review your budget, if you are working for an organization, you have the possibility to discuss with a donor. Just organize a discussion and advocate. PSM should be, I've seen in many countries that PSM staff was in a small room just around the corner, and nobody were talking to them except when they have something to ask. You need to emerge from this room. You need to show yourself and to see that you manage things very well. But you need to show to your manager that you know things, you know facts, you know what's happened before COVID, during COVID, and you know what it will happen later on. Advocate, coordinate, cooperate, and things will change. It will take time because you cannot do that in 1 week. It will take years. Start now. If you want to comment on what I said, no problem, you're welcome. Huh? Silence. Nobody wants to talk? Nobody want to speak with me? Well, we are talking about disaster, earthquake. The day you have a 9.1 earthquake, I'm not sure that we will be ready for that. So right now we can manage disasters, but if one day you have a huge disaster, I'm afraid that because of the impact of this disaster, we won't be ready. So should we stop here or?
Hello.
Yeah.
Sorry, Nicolas. Just maybe for you to elaborate, you were saying that we are not ready for big disasters like a bigger earthquake than what we are used to. So what do you think is the best way that we can engage, either coordinate or practice for that, as in focused for that?
Well, for me, coordination is very important. Coordination and cooperation. Nowadays it's very difficult to cooperate and coordinate for several reasons. Many organizations, they have their own agenda, they have their own business, they have their own objective, and etc. So
we're fighting for the same chunk, as in we are fighting for the same resources, or from the. Okay.
Yeah, but what I used to do and what I used to say, it's let's say to organize a big coordination and cooperation plan. That's mean a conference with everyone. That's mean all the NGOs, the United Nations, the government, and to have an approach on this kind of preparedness plan in case of emergency. For example, you have 10 or 20 organizations. Each of them should be in charge of that. So probably you will not be in charge to put 1 million PPE in your warehouse, but probably to split this type of inventory management according to the various organizations you have in your country. So again, organize that. Following the COVID-19 pandemic, following the Ukraine and Russia war, we find out our PSM was weak and we were not able to answer correctly to the pandemic. It needs to stop. We need to change that. So we propose a conference with everyone. We will talk about efficiency, about resilience. We will talk about PSM activities, etc., etc. A big conference, 3 days conference, which at the end some kind of action, you know. So.
Yeah, I get it. So here in Zimbabwe, we had a cluster approach which was headed by WFP. So they were interrogating the response to we had an earthquake. It was in 2019. So they were grasping like what we are doing right now. That what did we learn from the COVID-19, and then how can we improve from that? So it brought together different organizations trying to come with solutions to the future. It's more of a preparedness team.
Don't forget to include as well the private sector, the academy, the schools, these kind of things. You know, they can help you. They may help you in some kind of research or whatever. You, not only the organization, the UN organization, NGO, local, international, government, everyone, they have their role to play in this kind of future event. And much more you prepare all together, better is.
Yes. Thank you for that.
Yep. Anyone wants to talk with me? No?
Hello, Nicolas.
Hello.
Yes, this is Mohammed Ba speaking from Sierra Leone.
Yeah, hello, Mohammed.
Yeah, so, well, not too much of a question, maybe a contribution from what we have learned from the Ebola, the COVID-19, and also the Ukraine-Russia war. So I was going to say maybe again, we'll continue to have these discussions, and it's going to continue for a very long time. Maybe what we need is to actually have again some of these factories or manufacturing companies at a regional levels, maybe, or continental, you know. So because we see, for example, the Ukraine deal for Ukraine. So they signed for, I think, 6 months. When the 6 months elapse, they have to sign again for another 3 months. So, you know, every year. So some of these things, they are beyond, you know, just a nation control, you know. So I think advocacy should be placed in multilateral, you know, discussions, just so that again, one continent will actually not where conflict in one continent will not hinder the global, you know, supply chain.
Yeah.
For example, when the COVID hit for Africa here, I think we don't have manufacturing companies for PPE, for example, you know, and other pharmaceutical products, you know. So maybe if they have these discussions at multilateral levels, just so that we have some of these for essential services or goods, the production, we have them at maybe continental level, just so that one supply chain and one market or source cannot affect, you know, the entire supply chain, the global, you know. I know it's complex, but this is something, it's a capital investment, but it's something they need to start the discussion. Thank you.
Yeah, you know, it's very complicated to have a local manufacturer in your country or in my country or whatever. If I remember correctly, in Congo Kinshasa, for example, you have before a huge factory. They used to produce I don't know, T-shirt or whatever, and they moved to China because it was cheaper, you know. So now we are talking to bring back this factory to the country to produce masks, but is it cost effective? I'm not sure, you know. So for the other manufacturers and factories, yeah, sure. But again, you need to ensure the right quality. And for that, only one organization can say yes if you produce pharmaceutical product in your country. It's WHO. That's mean if, for example, you have a donor like the Global Fund, then we need WHO approval to be sure that the factory in your country is WHO approved. If not, you will not be able to buy a product from the local manufacturer. So it's very complex situation. And for the PPE and for the pharmaceutical products.
Okay, Nicolas, I understand from your side. Actually, just to share again this experience, I was an Global Fund grant NFM3 for Sierra Leone. Actually, the COVID hit at a time when we were implementing the mass campaign, malaria mass campaign. So when we had the COVID outbreak, the COVID-19 outbreak, so initially we would not plan for provision of masks, face masks. So what we resort at was actually to have a locally made face mask, which was approved by the Ministry of Health and WHO. So that was used because in the distribution of the bed net, the bed net, and also going to the local, areas, the last mile distribution, you need also hand sanitizers and the face masks. So we had to use locally made. Again, we are going to say actually we didn't have that quantity in country. So you have to wait again for another 3 or more months before you get the quantity. So because at that time we know there was actually shortage on the the supply of face masks. So that was how we actually it was the alternative for the WHO approved face masks. So it was the alternative. So we had to resort in using the locally made, which was with a cloth. So having all this experience, we are just saying if we have it at regional level, we have some of these manufacturers at regional level, say West Africa, for example, or even Africa, that you just so that the proximity is at least not that far, I think will also help. I know it's going to be a long discussions, and we have other factors again to look at in getting all this, not only maybe also access to raw material, other things. I know all this, but I think for those which can be possible, it's better they start these discussions, because as we say, emergencies or natural disasters, these are inevitable, they always come. So I think, well, in my opinion, I suggest if it's a good idea, then we push for some of these discussions. Thank you.
Okay. There are some questions I can go quickly. I do believe that many countries did not review lessons learned from the COVID-19 pandemic. There is a little no plan for PSM in emergency preparedness plan for public health challenges. So what specific public sector focus strategy can we implement to ensure PSM is not neglected? What I used to do in many countries, it's especially for the global funding grant, I was writing a quality assurance plan. Quality assurance plan cover all the PSM activities. And for that, you need to assess the country at national level, provincial level, at district level, and to assess the infrastructure, the transportation, etc., etc. You assess absolutely everything. Once your assessment is done, you present that to the country actors, government, MOH, finance, transport, public sector, academy, NGO, United Nations. 5 days conference, as I mentioned earlier. 5 days, 5 days. You put the 5 days and you explain that your assessment conduct to this result. That means we have a problem. We have a problem in each of the activity of the PSM. We have problem in transportation. We have problem with computer. We don't have computer. We have problem in training, etc., etc. And all the actors will be here in this conference. Everyone will have to face the reality you have assessed. At the end of these 5 days, each of the actors should be able to propose to use something. Money, solution, training, whatever. This is the best way to remove the PSM from the darkness. I don't want to say that the PSM is in the darkness and poor people, they are not well recognized. But anyway, it's one of the ways to show that the PSM people and PSM staff and manager and all related activity work and needs the other, needs to coordinate. And this conference with this kind of assessment of all PSM activity should help you. I suggest we have specific cluster for pharmaceutical during pandemic, and that they assigned to be an agency, just 11 clusters. So that will be, yeah. I mean, I mentioned only 11 cluster, maybe 12 cluster. This is only OCHA who proposed this kind of clusters. You may have 13, 14, it depends on the organization. I just propose you one point of view, and you may find other in the internet. In the internet or with other organization, I mean. Someone is talking about bureaucracy, corrupt tendency. Yeah, well, that's a problem. That's a problem. I have no solution for to remove the bureaucracy and corrupt tendency. Even during the COVID-19, I was in charge in Southeast Asia to procure certain material, and the bureaucracy nearly killed me. I have to say, people, we need to procure quickly this material to save life. Yes, but you need 3 signatures, you need that, you need that, you need evaluation, you need... The bureaucracy was still there. I mean, COVID-19 or not, the bureaucracy is still here, didn't change. For the corruption, I'm not the one to talk with. You need to talk with the government, you need to talk with the company, you need to talk with the... nothing I can do against corruption. Empower. Are we okay, or we still continue?
Sir, if all questions, sorry. I'm saying if all questions, answers are done, so we can end this session now.
Okay, you can share the slides to everyone anyway, so at least they can play with the links and try to find a better answer, or to put their own knowledge inside this presentation. Anyway, this presentation is their presentation. So they can use it for other purpose. They can use it for discussion with their manager, with coordination, cooperation. So it's their slides and they can do whatever they want with.
Noted, sir. So what I'll do is, let me share a presentation here as well in the chat box. Also, I will be sharing the deck and the recording of this session right after the expert session, so that if they have any further questions, they can write to me and I'll forward it to you.
Yeah, no problem. No problem.
Okay. Okay, let me give the PPT here as well.
You're gonna put in a chat?
Yes, I'm putting in chat. It will take 1 or 2 minutes more, then it's uploading. By the way, sir, it was a very knowledgeable and informative session. Thank you so much for all the questions and answers. And I have shared the PPT with the with all the candidates in the chat box, and I'll share it on the email IDs as well. The people who have joined the session.
Okay, so that's been okay, fine.
Okay.
So they can download now the presentation and they can use it.
Yes. 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 This is for all. If you have any further questions regarding the PPT, so please feel free to write to me. I'll forward it to sir. Okay, and then we'll get back to you with the relevant answers. Thank you, sir. Thank you for your time and support.
Thank you.
Thank you all for joining the session.
Thank you, everyone. Have a good day and take care.
Thank you.
Same applies. Thanks.
Thank you.
Bye-bye.
Thank you, Nicolas.
Thank you.